Selamat sore. Welcome back to my no-name channel. I'm Bruce, and this is another Bali COVID-19 update for June 27th, 2021. And, well, last week I said I hoped there was going to be better news. So far, and it's Thursday, I still have a few days before I upload this, so yeah, I do these videos in parts sometimes, so maybe the news will get better in the next few days. Let's hope so. But today we're going to talk about first the numbers as they are right now. So this is Thursday. Yesterday we had 182 new cases, all Indonesians. 153 were local transmissions, and 32 were for domestic travelers, and 2 were from international travelers. Why have I mentioned that? Because this has become an issue right now. Our numbers are going up and up, and in excuse me, in the country today we had 15,000, a new record. And so there's been a lot of talk from Balinese officials and others about what's going on with the numbers going up. And so let's talk about that first. Work from Bali is one of the causes of increasing COVID-19 cases. Okay, this is one side of the story. So the number of positive cases of COVID-19 in the province continued to rise over the last week. Last 2 weeks now. The secretary of the Bali province COVID-19 task force, Imade Renton, said that this was due to the high intensity of domestic travelers visiting Bali. And he said they came to Bali for various purposes: short visits, official visits, and work from Bali. Now, this is the controversial part, the work from Bali, he said. So, Renton said the high intensity of the domestic visits was also influenced by the positive cases of COVID-19 in various other regions in Indonesia. And later on, I'm going to talk about Balinese officials that it has nothing to do with us, what's going on outside of the island. Okay, take that for what it's worth. So, Renton said that on the basis of the huge numbers outside of the island and the rising numbers inside of the islands, there is going to be a tightening of all screening at the entrances, airports, and harbors. And he said, we are increasing the tightening of entrance gates, obeying the protocols, health protocols. The increase in COVID-19 cases in Bali began to occur since last Thursday, that was the 17th. Based on data from the Bali Province COVID-19 Task Force, at the time there were recorded additions of 67 positive cases. That number increased the next day. At that time, the positive cases increased by 95. The day after, on Saturday, increased again, reaching 155. So you see, and now we're at 187 today. And separately, the head of the Bali Provincial Health Office, Ketut Swarjaya, revealed that the increase in cases has not significantly affected the bed occupancy ratio, which is called BOR in the news usually. As of Tuesday, he said it's relatively safe, below 50%. Currently, Bali has 2,169 beds for COVID-19 patients, and that's filled by 416 people, or 21.36%. And as of intensive care units, Bali has 221 beds occupied by 57, or 25.79%. Hopefully, he said, the number of positive cases can continue to be suppressed. Okay, so Imade Renton says, right, our cases are going up because of domestic travelers. Okay, now, if you've been paying attention to social media, TikTok, YouTube, Instagram, you'll see a lot of people are at the airport, so there is a lot of traffic going on. And well, this has been encouraged. by everybody. We want the domestic travelers, at least there's some income, right? There's some business going on here. And so, has that been good or bad? Well, depends on who you talk to. So in another take on this, tourism entrepreneur denies work from Bali as the cause of COVID-19 spike. The Bali Tourism Transport Association denied that the call for work from Bali is the cause of the surge on the COVID-19 cases. The Bali Tourism Transport even demands that foreign tourists visit Bali to be opened immediately. So this is according to the head of Bali Tourism Transport, Nyoman Sudiartha. The closure of foreign tourist visas is very detrimental to us who have been hoping that tourism can be reopened. We asked for COVID-19 data to be open because we have carried out the sincerest procedures. Is it true? Because WFB work from Bali, so he's questioning whether the spike is from there. According to him, the Work from Bali program really helps tourism on the island, even though the volume is still small at the time. He said, we really feel it. Please don't politicize our condition. We really hope that tourism can recover, or we will take to the streets for our survival. We have many dependents beside our business. Additionally, the chairman of the Association of Indonesian Tourism Industries, Bali Ida Bagus Agung Partha Adnyana, denied that the Work from Bali program has contributed to the increase in the number of COVID-19 cases in recent days. He said, because a pandemic situation like this is very normal. Things will go up and down until herd immunity is formed. Don't overdo it. Also invited the community and all tourism stakeholders to join hands and create a conducive situation and to welcome the Work from Bali program. As he said, this is done by implementing and monitoring strict health protocols. This was also seconded by a hotel and shopping center businessman in Bali who said that it was not correct to think that the Work from Bali program was the trigger of the spike. He said the program is very good for the Balinese economy, especially during the current school holiday. Current school holiday has actually been going on since March of 2020. If we're going to open things up, let's get the kids back to school. But in my hotel, he said, the occupancy has reached 25%. This is good. In fact, the WFB program has more positive impacts for the Balinese people. Okay, there's another person saying things are, well, there's a number of people here, 3, saying, okay, don't dump on the Work from Bali program. This is not the reason that the numbers are going up. Now, if we really have 7,000 people a day coming in, as I talked about last week, and if you take a look at the people getting off the plane, what's going on at the airport, you could believe that. How many of these are actually Work from Bali, from Bali program participants? Don't know. The program is actually not supposed to be officially rolled out until later, so I'm not sure how many people are here for this program. Well, another response to Pak Renton's comments. Provincial government now denies Work from Bali triggers COVID-19 cases soaring. The Secretary of Bali Province COVID-19 Task Force, Himadane Renton, mentioned that the Work from Bali program was one of the triggers. But the head of the Bali Province Communications Information and Statistics Agency, Gede Pramana, denies the statement. The spike in cases has not only occurred in Bali, but in other regions of Indonesia. So it's inappropriate to mention the WFB policy as the trigger. Everybody seems to be wanting to protect this program. Additionally, Pramana said, domestic travelers have to go through strict travel conditions. such as negative swab tests in accordance with the applicable health protocols. According to him, the current spike in cases in Bali is partly due to increasing community activities and the emergence of new mutations of the coronavirus. Although if you look every day, we've got 20, 25 cases being brought into the island. So when he says this is just community activities here, yeah, that's not true either. The former head of the Bali Provincial Housing and Settlement Service, that's who Pohlmann is, assessed that the work from Bali program was appropriate. The reason is the impact of COVID-19 pandemic on the tourism industry is felt by all the Balinese people, and we all know that. The WFPB policy will greatly help the Balinese economy recover, of course, while still prioritizing health protocols. He hopes that the assessment of the policy is not based on assumption and logic alone, but also supported by data and socioeconomic conditions of the community. So, okay, there's some blaming going on here and some disagreements about where these spikes are coming from. Okay, we know that people are coming in and getting into Bali and then tested and they're positive. So how are they getting here in the first place? Where are the strict protocols? Is everybody going through them? What's happening there? That's a good question. Okay. And so we have these cases going up and up and up. Apparently, it's been suggested that the new variant, which I think it's the Delta variant that you're talking about here, is on the island, but there's no positive proof yet. So, Bali governor asked head of health office to research alleged new variant virus in Bali. The suspicion of virology and molecular biology experts from the Faculty of Veterinary Medicine, Udayana, said that the presence of the new variant may exist here. And this was immediately responded to by the governor. The professor of virology and molecular biology, Mardika, suspected that the Delta virus, which is a new variant, has already entered Bali. Suspicion has been that the new variant entered Bali by looking at the large number of transportation in and out of Bali and the lax conditions for entering Bali. In addition, the member of the medical expert team of the task force for the acceleration of COVID-19 handling from Jimbrana said that the entry filter to Bali, which is not strict, creates the opportunity for people to bring the Delta variant into Bali. Professor Mardika said that there's a strong suspicion that the new variants, including the Delta type, are already in Bali because of a number of factors. The biggest contribution of developing new viruses is due to human crowds and environmental factors, he said. So, responding to this, the governor has immediately ordered the head of Bali Provincial Health Office, in collaboration with Sangla Hospital and UNAD, to conduct research on new cases to find out whether the new case of COVID-19 was a new type of variant, such as what's happened in India and South Africa. Also conduct searches on people who have the potential to be infected, said the governor. And so, trying to figure out if we've got the Delta variant here. Is that likely with all the new cases? Possible. Good idea to see what's going on here. We don't want to be overwhelmed like what's happening in Jakarta. So, things are okay. This is not real positive. And well, let's add another negative thing here because of what's happening with the numbers. Hong Kong adds Indonesia to no flights list. Recent weeks have seen Indonesia become a primary source of imported coronavirus cases in Hong Kong, with both Cathay Pacific and Garuda Indonesia subject to temporary bans on incoming flights from Jakarta for bringing too many infected passengers. But Hong Kong is going to tighten the restrictions on travel from Indonesia. According to a government statement issued yesterday, all passenger flights from Indonesia will be prohibited from landing in Hong Kong starting at midnight today, June 25th. Current health regulations in Hong Kong stipulate that a country-specific flight suspension will be imposed when a total of 5 or more travelers from the same place, regardless of the airline, test positive for a mutated COVID-19 strain on arrival within a 7-day period. The statement said that the number of imported cases from Indonesia with more infectious virus variants has now reached the threshold to trigger those restrictions. And this move was announced after Hong Kong's Center of Health Protection reported a preliminary positive case in the community involving the Delta variant, which we talked about a lot, breaking the territory's 16-day streak of no local cases. This patient is an unvaccinated 27-year-old airport worker who previously had contact with incoming cargo flight crews, reportedly from a Southeast Asian airline. Due to the local epidemic situation in India, Nepal, Pakistan, and the Philippines, the Hong Kong government said the entry ban for those will also remain in place. So Indonesia joins these other countries now. Well, in the meantime, what's going on with micro lockdowns? What's going on with the vaccination? I don't know. And let's talk about numbers for today. Okay, this is we're going to switch over to my Sunday inclusion of the numbers. Okay, and so let's get to the numbers. It is Sunday, and if you've seen parts of the video before this, you know that I've been recording this since Thursday. There is just so much stuff, and there's so much stuff that I've left out. Let's take a look at the numbers, which are depressing. Okay, what do we have? 246 new cases. So we're going up, up, up. And take a look at the chart here. Indonesian record yesterday, 21,095 throughout Indonesia, mostly centered in Java. Take a look at the chart. Okay, let's jump to the numbers in Bali. Then 246 yesterday gives us 49,372 total cases, 46,512 recoveries, 1,550 deaths. And now we're up to 1,310 active cases. So I hate doing weeks in a row of bad news, but this is bad news. Of the 246 cases, 201 are local transmissions, 43 cases from domestic travelers or tourists, and 2 cases from international. So we're getting more and more people showing up here with the virus. This 5-day quarantines, all the quarantines, the testing, this is not working. People are showing up here and they're sick. And I haven't had time to go into this, so I'm just going to mention this today, and I'll mention it in the wrap-up. What do we have? There's a new rule that you have to have a test done, a PCR test, with a, whatever those are called, Q codes, so that you cannot counterfeit this. You can't have a fake one. And so that is now a new requirement for Bali. If you want to get into Bali, you're going to have that. So this is supposed to stop people coming in and spreading the virus. Where are cases distributed? Denpasar 89, Badung 50, Buleleng 25, Gianyar 22, Jembrana 19, Tabanan 9, Karangasem 4, Kungkung 2, and Bangli 0. Okay, Bangli, doing well. So we've got these the cases are here. They're going up everywhere. They're going up in Indonesia. They're going up here, despite what people say. There is a connection between what goes on in Java and other parts of Indonesia and what goes on here, because people come here. People come here on transport. Truck drivers go through here all the time, pass right through my neighborhood. These big, huge trucks going from Java on to islands to the east. And so the barcode is going to be one way, hopefully, that this will cut down on transmissions coming in, people coming in from outside that are testing positive or that are positive. Okay, so there's a lot that's going to come after this. Right now, I'm at numbers on Sunday, and so there's going to be, I'm going to cover what's going on in Jakarta, in Java, because that's important, because that affects us. And what the president's doing, talk about the restrictions and a lot of other stuff. So there's still a lot to talk about here, and then we'll do a wrap-up. Okay, so not good news again. So what's happening in Jakarta and around Indonesia, outside of Bali? Because despite what one of the articles that I'm talking about says, where person in Bali said, well, we should open what's happening in Java, that doesn't concern us. It's got nothing to do with us. It does. So according to this article, hospitals collapse. This is from the Jakarta Post. Hospitals collapse as second wave engulfs Indonesia. Indonesia's COVID-19 cases soared to levels not seen before, and so some hospitals have been forced to set up emergency tents to cater to the deluge of patients seeking care after potentially contracting the Delta virus. Nationally, on Friday, there were 18,872 new cases, the second highest number after the day earlier with 20,574. And from June 21st to June 25th, 82,958 new cases and 1,709 deaths. With the government refusing to impose large-scale social restrictions and instead opting to use the micro-scale restrictions, PPKM, there have been concerns raised over whether the healthcare system can hold out before the infection curve reaches a plateau. Videos of overloaded hospitals have been circulating online as families of COVID-19 patients have reported difficulties finding available beds in ICUs at referral hospitals. One video shows a suspected coronavirus patient lying on the ground next to an emergency tent as another is being transported on the back of a pickup truck at the Bekasi Regional Hospital. The video provides a telling image of the condition of the country's healthcare system as it battles a surge in cases that's been fueled by the Delta variant. Okay, so I talked about people blaming the Delta variant last week. Has it been proven that these are the Delta variant, and does it make any difference right now? Whatever this is, it's the Alpha, the Delta, if it's a different one, our cases are skyrocketing and the hospitals are hard pressed. As of Friday, Jakarta had 497 beds left for COVID-19 patients with a bed occupancy rate of at least 90%. Meanwhile, around 90% of hospital beds for COVID-19 patients are occupied in West Java, according to data from the Provincial Administration's Virus Information Center. With some bed occupancy rates at over 100%, we can say our hospitals have already collapsed, according to Indonesian Medical Association West Java chapter head Ika Mulyani. The current wave of infections is also severely affecting health workers, with many testing positive and in extreme cases losing their lives. According to Lapor COVID, 981 healthcare workers have died of COVID-19 as of Friday. The IDI, the Indonesian Medical Association, provided similar figures, saying 949 healthcare workers had died as of Thursday. At least 31 doctors died in the past 2 months, according to the Medical Association. and 24 of those died this month only. The National Health Minister said that the government is planning on providing more hospital beds, especially in Jakarta. However, experts have expressed doubts that adding more beds will prevent a total collapse of hospital and healthcare facilities. Mastalina Payne of the Indonesian Epidemiologist Association said providing more beds is only going to delay the inevitability of hospitals becoming overwhelmed with COVID-19 patients. She said, we can appreciate that the government's adding more hospital beds, but how long can we keep this up? She said that adding more hospital beds is just going to increase the need for more healthcare workers, more ICUs, in order to treat the patients coming in with severe cases. In order to prevent hospitals from collapsing, she said the government needs to focus more on preventing infections by severely reducing people's mobility and conducting more rigorous contact tracing. The chairman of the Indonesian Medical Association, Pak Kumade, said that he agreed with this and added that adding more hospital beds is no guarantee that existing healthcare facilities are going to be able to cope with the incoming patients. He said there's already a very critical situation that cannot be resolved simply by adding more beds. Adib warned that adding hospital beds would also mean adding more working hours for health workers and increasing their exposure to COVID-19. Adib also warned the government that the crisis on Java could spill into other islands with less developed healthcare systems. As long as strict travel restrictions are not in place, bed occupancy rates and positive cases will increase on other islands such as Sumatra and Sulawesi, he said. And so, is this what we're seeing here in Bali? I don't know. As daily cases break records, Pak Jokowi has cause for more discipline and said, mask up, please. So, Pak Jokowi has called on Indonesians to improve discipline in wearing face masks and implementing health protocols to curb the COVID-19 spread, which is breaking records almost every day. He said, we must remain disciplined in taking care of ourselves, especially wearing masks. He asked the public to stay at home to reduce the potential for contracting COVID-19. Is that happening in Bali? I don't know. I ask one simple thing: stay at home if there's no urgent need to go out. Only together we can stop this epidemic, he said. Health officials blame family gatherings following the Eid al-Fitr holiday with lax health protocols and new variants of concern for the spike. We've already talked a lot about what everybody was fearing after Ramadan, that for Eid al-Fitr, Lebaran, everybody was going to travel. And as I said last week, it was estimated 5 to 6 million people were traveling. And take a look at what's happening with our numbers. And health officials are blaming family gatherings for this. Additionally, there's migrant workers coming back from abroad, bringing with them more infectious virus variants, like the Delta variant. Previously, President Jokowi stated that the government chose to implement the small scale, the PPKM, where I talked about the micro lockdowns, instead of an indiscriminate lockdown because of the way that it could affect the economy. The president said, PPKM, micro, and lockdown is basically similar, limiting community activities. There's no need to argue. The president said he's optimistic that PPKM, micro, implemented properly, could control the pandemic. So, despite experts calling for a lockdown, a real lockdown, the president is not going to bend on this. He's going all the way with PPKM right now. Is that going to work? I don't know. The idea that you can control the situation at a community level is a good idea. But do you control it? Is there enforcement? Are people going to be self-disciplined? Are they going to stay home? I don't know. I'm going out tomorrow. I haven't been out today, but as I mentioned at another segment of this, my wife was out at the market, said it was pretty empty, but that was because everybody's getting vaccinated that hasn't been vaccinated. President Gerokgak said there's no need to debate whether PPKM micro or lockdown is better option against these surges, adding that both are similar and aimed to restrict people's activities. He said that it's the government's top choice because it can control the virus outbreak without hurting the economy. He said the government has decided that PPKM micro is still the best policy to take to curb the COVID-19 transmission up to the village level and go straight to the roots of the problem, namely the communities. According to Gerokgak, PPKM micro has yet to be implemented comprehensively, only sporadically in certain places. He's urged regional leaders, governors, district heads, mayors to strictly enforce the micro lockdown and optimize the COVID-19 watch post at every hamlet or urban wards. In his statement to the press, he said this outbreak is real. Anyone can get infected regardless of their race, origins, economic status, religion, or tribe. This disease does not care who we are. If we are not careful and do not protect ourselves, we can catch the virus. So, micro lockdown extended to July 5th. The government is starting to play hardball, as I've mentioned. The Minister of Home Affairs, Partido, issued latest instructions to regional heads to strictly enforce the micro community activities restrictions. And these instructions cover the setting of office hours all the way through restaurants. The regulation is contained in the instruction of Minister of Home Affairs number 14/2021, and it has 18 points. Among them are work from home, as much as 75% in red zones and 50% in the other zones. Regencies, cities that are in the red zone are restricted by applying work from home for 75% and work from office for 25%. Also, eating places should only be open until 8 o'clock local time. Capacity is limited to 25%. Additionally, teaching and learning process in red zones is carried out online. Now, we're not in red zone in Buleleng, but we're still online. Likewise, places of worship in the red zone are temporarily closed until the situation is declared safe. And so this has been extended again. The micro, what some people call the micro lockdown, has been extended. So these upsurges, yesterday was 20,000, today less, I think maybe 17, 18. I didn't quite look at the numbers. I'll be talking specifically about the numbers tomorrow. This is Saturday when I'm filming this. With the unprecedented surge around the country of the COVID-19 virus, the military has been ordered to carry out vaccines in 3 districts in Bali: Jembrana, Buleleng, and Tabanan. This was carried out on order of the governor of Bali in order to finish the COVID-19 vaccine before June 30th, when this current batch will expire. In addition to that, the military will be working in NTB and NTT, engaged in vaccination activities as well. There are 230,000 doses of the AstraZeneca vaccine, which will expire in another 4 days. And so the military has been out. They've been out here in Buleleng, not far from the house, down by the harbor. And specifically, they'll be in Negara District, Jembrana District, Suririt, and Buleleng, Tabanan in the Penebel District, sub-district, and as well as at the Army Hospital down in Udayana. And this is to actively help vaccinate the people before the vaccine runs out. And so basically anybody that is eligible is being vaccinated. Anybody that's eligible is being vaccinated. And that's good news. According to Pak Mardika from the military, he's the head of health there, they're targeting all districts and cities in Bali to be able to vaccinate as many as 40,000 doses a day in order to get rid of the remaining 230,000 doses. And he said there are areas of Bali that have high vaccination achievements, and we know that, such as Badung, but in other regencies there's still low numbers. Jembrana, Bangli, Buleleng, Tabanan. And one of the causes of this, according to him, is that the public is less receptive in some areas to the vaccine. And additionally, there's fake news or hoaxes circulating that the AstraZeneca vaccine is dangerous. He said, because the target is 70%, right? The target is that 70% of Balinese people who deserve to be vaccinated are 3 million. Right now it's only 70% of the 3 million. 70% is a little more than 2 million per day by June 30th completed. So good luck to the military in getting rid of these 230,000 doses so we can get everybody vaccinated here. And today people have been scurrying around. According to my wife, who was out at the market today, she said, wow, it was almost empty because everybody was out getting vaccinated because they heard that the government is not going to be offering assistance to anybody that's not vaccinated anymore. So last week I talked about this, where was that? I think it was in Jembrana, and I heard that Tabanan has said the same thing, and I didn't hear any public announcement. I did hear a public announcement this morning that vaccines were going on. And you should come down if you're over 18. But apparently people have heard from somewhere that the government will not be giving you any help. So if you need to go to Kantor Lura or Kantor Chama to get some documents, forget it, unless you're vaccinated. So the government's starting to play hardball. So, what about Buleleng? Many residents live in other areas. Vaccination in Gerokgak district, Buleleng, only reached 56%. So, there's been a push in the Gerokgak and Sririt areas after the city here went through their intense vaccination program weeks ago. And the Buleleng Regional Secretary, as well as the Secretary of Buleleng COVID-19 Handling Task Force, said that vaccinations in Gerokgak district could only be carried out up to 56% of the target of 70%, because many of the residents of Gerokgak live in other places, and they do not pass the screening. However, it said that the government would still assign each village to collect data, again, the number of residents who have not really been vaccinated, and then directed to receive vaccinations at the nearest health center. So little heat's being put on people up here in Buleleng and in Tabanan and Jembrana to get everybody vaccinated. For example, if they have been vaccinated at their place of residence, there's no need for them to be vaccinated here. If not, the healthcare center is always ready to vaccinate. So, we've got a ways to go here. Saririt, Gerokgak, Banjar, Busunbiu. There's a number of villages here that are still not fully vaccinated, and so the push is on to get those people vaccinated. And so, yeah, that's a problem. Up here in Buleleng, if you don't know about this region, a lot of people up here work other places. They either work out overseas, cruise ships, they work down in Denpasar, Kuta, Ubud, they're all around. It's amazing. We just don't have the economy here for people who want to work in the tourist business. And so a lot of them go down south. And I've often met people when I'm talking to somebody in Kuta or Ubud, and they'll say, where are you from? I say, well, from Singaraja. And they'll say, oh, I'm from Singaraja too. Well, yeah, they moved to a tourist area to work. So those people are still on the rolls a lot of the times at home. And so they're listed as needing to be vaccinated, but in fact they're not there. They're somewhere else. And so that's one of the things that has to be taken care of. One of the complications up here up here in Buleleng. Okay, next story. And here in Bali, what's happening? Well, we have all sorts of things happening. Right now, Denpasar parks closed while lockdown hoax is called out by government. So the Satpol PP local government police closed the public space of Puputan Field in Renan on Tuesday due to the recent rising numbers of COVID infections in the city. The head of Bali Satpol, Pak Dermadi, said that no cross lines and tape were installed to stop people entering the park, with officers stationed to control community activities in the area. He said, so far, the people who exercise the field have been tolerant. Our patrol officers have also been reminding the public to obey the protocols, as lately we have noticed people becoming less and less vigilant in using them. We've closed the field for an indefinite time, he said. As long as the field is closed, no one is allowed to enter. Officers will continue to monitor the situation because the development of COVID-19 cases is now increasing again. This is a precautionary measure. So the micro lockdown or micro community activity restrictions, PPKM, has been extended until July 5th. So we ain't opening July 1st. Meanwhile, the Bali provincial government's asked the public to be careful about the graphics on social media claiming the implementation of large-scale social restrictions in Bali, as this is a hoax. The head of Kominfo and Statistics Agency for Bali Province, Igede Pramana, said that based on search results, the infographic is an image taken from CNBC Indonesia news site with the same news title dated January 6th, 2021. Distribution of the image at this time is a misdirection or hoax, he said. Additionally, he added that the infographic also described Bali as a red zone. In fact, every place in Bali currently is an orange zone, moderate risk. Dissemination of this old image is a disinformation for the public, which has the potential to cause much inconvenience, to say the least. He concluded that the Bali provincial government, through the COVID-19 handling task force, continues to appeal to all parties to comply with health protocols and strive to maximize vaccinations. We should all focus on those two important things and not be affected or provoked by fake news. Okay, no fake news. And this is what's happening in Bali, another segment on what's happening in Bali, and naughty foreigners as well, although, well, whether they're naughty or they're just absent-minded, who knows. Dozens of foreigners netted in the orderly operation of masks. Dozens of foreigners, majority of which are nationals, foreign nationals, were caught in the operation checking on masks in the Canggu area. Where else? On Friday. This was carried out with a joint team with the Badung PP Satpol, as well as immigration officials and Badung Resort Police. The head of the Public Order Section at Badung Regency Civil Service Police Unit explained that the orderly operation of mask was held as a form of disciplinary enforcement for COVID-19 prevention health protocol. This was to remind people of the importance of preventing and avoiding the transmission of COVID-19. Violators are subject to sanctions in the form of punishment, ranging from physical punishment in the form of push-ups, we're still doing the push-ups, or fines. The majority of foreigners who were found not wearing masks paid an administrative fine of Indonesia of 100,000 per person. I thought it was 1 million per person. Okay, I don't know. We'll go with 100,000. The investigator, Pak Gede Ardika, for the Badung Regency Satpol, said that the majority of violations were for not wearing masks properly or not wearing masks at all. The reason for the violators not wearing masks were mentioned in a variety of ways. Some claimed to have forgotten. Some said that they did not know that masks were required. Okay, I can get that you might forget to wear a mask and take it out and then think, okay, well, I'm out already, and so yeah, I'm just not going to go back and get it now. Be cool. I did. I have gone out. I got almost all the way to the main street to Jalan Diponegoro. I realized I didn't have a mask. I was with Zoe. We had to turn around and come back and get it. I can't believe that anybody doesn't know that masks are required. If you are on the island, how can you not know it? Whatever the reason, Ardika said, we have to enforce the rules. Those who violate, no one refuses to pay the fine. So, well, at least people are paying the fine now. They're not refusing like they used to. A French citizen who was caught for not wearing a mask admitted that he forgot to wear a mask. He stated that he was aware of the regulations that required everyone to wear a mask to prevent transmission. And he said, I usually remember to wear a mask when I leave the house. I really did forget. He said, and it noted he's fluent in Indonesian, I think the regulations in Bali are good. Oh, thank goodness somebody agrees with it. Okay. And what about opening? So, let's talk a little bit about opening, because this is June 27th, and, well, opening was going to be June or July. June is just about finished, and July is coming up, and every date I've seen now talks about the end of July. So, Bali senator encourages central government to keep the border reopening and work from Bali program on track. Bali senator has urged the central government to keep to the plan. AA Nura Adi Ardana said that despite the surge in cases of COVID-19 variants in several areas in Java, such as Jakarta, Kudus, and Madura, the plan to revive Bali tourism sector must be continued as planned. He said there's no relation between the surging COVID-19 cases outside Bali with the plan to reopen our border for international visitors. So the program must continue. I'm not quite sure how there's no connection between what's happening in Java, what's happening here. It's an interesting take on things. However, he admitted that the situation might increase the reluctance of travelers coming to visit the island, but he's optimistic that Bali is still safe as long as all prevention protocols are strictly implemented in all the tourist spots, such as hotels, restaurants, and tourist attractions. If we can keep the island from being a red zone of COVID-19 transmissions, I think we should continue to the plan to reopen the border on track, as it would bring hope to the Bali people to end this crisis. He also claims that the Work from Bali program, which I've talked about several times already, could be one of the solutions for people in Jakarta to avoid the COVID-19 transmissions. Yes, send them here. Surging in Jakarta by working remotely from the island through proper screening upon arrival. Okay, and the new rules about arriving in Bali, is that going to work? Hopefully. He also predicted that Bali's economy would fall deeper into crisis if the central government decides to postpone the travel corridor program. Most of Bali residents are currently in survival mode, and it could break down at any second if the border remains closed. So I urge the government to keep the program on track with strict prevention protocols in place. So is that going to happen? Are these strict prevention protocols going to continue? Because people have gotten lax. Let's face it, people are tired. This is COVID-19 fatigue. People have gotten loose, and you see what's happened with our numbers. They're going up and up and up every day. And in Java, it's a mess. Okay, so more on opening up. Now, I talked about this before. Last week, 2 weeks ago, this is Pak Sandiaga Uno, our friendly tourism minister. He was talking about the COVID-19 vaccine. holidays here in Bali, and so he's back at it again. And this is in the news. He's proposed the vaccine, and we know that to be an entry requirement for both domestic and international visitors in the future. Not that they have to have it when they come here. Okay, this is the problem. So on a press briefing on the 22nd, 5 days ago, he proposed the Bali governor and health minister prepare vaccination-based tourism for Bali as one of the efforts to increase domestic visitors that were recently reduced due to the surge of COVID-19 cases in some areas such as Jakarta, Kudus, and Madura. I proposed to the Bali Provincial government and health minister to give an option for domestic visitors to receive the COVID-19 vaccine upon their arrival. I'm going to talk about the pushback on this in just a minute. Sandiaga also admitted that the program was a direct order from President Jokowi as an effort to boost COVID-19 vaccine distribution in Indonesia. He believes that the program could reduce the reluctance of domestic tourists to visit the island. Each domestic visitor is expected to receive a vaccine free upon arrival at the airport. So people are going to be vaccinated as they get here if they haven't been already. Meanwhile, Sandiaga explained that the distribution of the COVID-19 vaccine to international travelers once the border reopens would be at their own expense. Apart from the negative result for the PCR test, international travelers who haven't received the COVID-19 vaccine prior to departure are also required to be vaccinated upon arrival at their own expense once the border reopens. So, if you want to come and you have not been vaccinated, you can come here if you've got a negative, not now, when we open, you can come here if you've got a negative PCR test, but you're going to have to take the vaccine when you get here. What kind of vaccine? I don't know. AstraZeneca right now, we've got Sinovac, we have other vaccines coming in that I talked about last week. But you're going to have to be vaccinated, so if you don't want to be vaccinated, you're not going to be in Bali. And so, what about Pak Sandiaga Uno's plan for the vaccine tourism? Well, according to the health ministry spokeswoman and the Bali Tourism Agency head, neither of them have been informed of the plan, the details of the plan. Additionally, an epidemiologist and economist told the Jakarta Post that a vaccine vacation program would draw precious resources away from the ongoing COVID-19 wave. Pak Sandiaga said President Jokowi has ordered the vaccination program to follow the footsteps of other countries. He noted that the program, if deemed successful, could be expanded to other regions. He said, the president instructed us to prepare for the vaccine tourism program because we have seen other countries starting to offer attractive vaccine-based tourism policies. Countries such as Guam, the Maldives, Russia, the United States, and United Arab Emirates have launched vaccine vacation packages to revive their pandemic-battered tourism industries. Well, that's interesting. I didn't know that. And Sandiaga said that the Indonesian government would prioritize Indonesian tourists. First, they would get the vaccine for free. The foreign tourists would pay under the private sector's Gotong Royong program so as not to disrupt the supply for the national mass vaccination program. And Pak Sandiaga added that 61% of Bali residents have received the first dose of COVID-19 vaccine, while less than 3% have received a second dose. And the government aims to inoculate at least 3 million Bali residents by August. Okay. Timeline seems to be being pushed back some. Indonesia is using Sinovac and AstraZeneca, as we know. I've had AstraZeneca. Pfizer and Novavax are in the pipeline. And we also have Sinopharm and Moderna and Sputnik 5 are in the pipeline as well. And all the vaccines available in Indonesia require 2 doses administered within 1 to 3 months of each other. It's unclear whether the vaccine tourism package would require travelers to stay in Bali for both doses. Right, that's one of the things I was wondering. The director of the Institute for Development of Economics and Finance, Esther Shri Astudi, said that a vaccine vacation program would do little to revive Bali's economy amid the larger scale economic challenges of the pandemic. Vaccine tourism program will not boost Bali's or Indonesia's tourism revenue much. Tourism and the economy will recover quickly if the pandemic is over, so it's better that the government focuses on handling COVID-19. And an epidemiologist from the University of Indonesia, Pak Wayono, said that tourism boosters such as this risk further overwhelming the country's healthcare system, which is already struggling handling the new variant. Tourism will create mobility and crowds. This will make matters worse. Why is the government talking about vaccine tourism when they should be imposing more restrictions and a lockdown? So is Bali going to open in July, or is it going to be pushed back? Things are crazy right now. There's an article here. Bali Tourism Association disappointed as the plan to reopen the border is predicted to fail. The Bali Tourism Associations expressed their disappointment with the central government's plan to reopen the border for international visitors because it's predicted to fail. The head of the Karangasem Hotel and Restaurants Association, Iwayan Karyasa, said that the majority of accommodation businesses in Karangasem were disappointed with the plan of the central government to postpone travel arrangement program in 2021 due to the surge of cases in Java. And according to this article, Pak Sandiaga Uno, in one of his statements, and he makes many statements, has stated that the plan to reopen Bali's borders for international visitors may be postponed until the third quarter, when COVID-19 transmissions are properly handled. And this statement has gotten a lot of negative responses from the tourism sector. And according to Karyasa, the actors in the tourism sector in Karangasem, we're so disappointed with that statement, especially with all our efforts and money that's been spent during the preparation stage before welcoming the tourists back. He also said that many of the businesses have lost their trust in the central government and urged them to continue the reopening plan. I propose the regional and provincial government in Bali to urge the central government to keep the reopening plan on track, as most of Bali's regions, including Karangasem, are now ready to receive tourists with all the prevention protocols in place. He also explained the importance of continuing the plan of both international travel arrangement and work from Bali program so Bali's economy can be revived from the COVID crisis, as all of Bali's regions were confirmed free from being considered a red zone. So we're not a red zone, but we're not a green zone. Right now, we're an orange zone, as far as I know. So things are getting strict. The government really wants to open up in Bali. We've got two different things going on that are interconnected. One is the situation in Jakarta is just crazy, in Java, in a number of places in Java. Second, our numbers have shot up. If you remember, 2 weeks ago, 22 today, we had 195, I think. So that has gone way up, and the push is still on to open by July 31st. Whether that's going to happen or not, I don't know. We'll talk about that in the wrap-up. But everybody is serious about this. So if you were here on the island, you need to be serious about it as well. The wrap-up. Well, what have we got? We have record cases in Indonesia coming almost every day. Things are really bad in Jakarta and some of the cities in Java. Our numbers are going up. We're still okay in terms of hospital occupancy rates, but that could change rapidly. The governor's ordered research to find out if the Delta variant is here. that can help. The vaccines, huge pushes, as I've talked about in earlier segments. People yesterday disappeared because they wanted to get this, because throughout all the different regions, these now are doing the same thing. They're saying, look, if you don't want to get vaccinated, don't get vaccinated. But you may not get a driver's license. You may not get a building permit. You may not get your new KTP. There's a lot of things that the government can hold over people to get them to get vaccinated. Do I think that's a good thing? I wish it wasn't, but we need to have everybody here vaccinated. Is that going to solve the problem? No, you can still get sick, you still can transmit it, but it's going to get better. And it was getting better until we got this surge. We were down, remember, not long ago, just 22 cases, and our active cases were way down as well. So part of this is due to the spike from the end of Ramadan, the Lebaran, people traveling when they shouldn't have been. People are still gathering, Indonesians and foreigners both still evading wearing masks. And there was, I talked about some foreigners here, and there was a couple of more stories that I just didn't add in here because, well, why kill it? So there's locals and foreigners. I just cannot understand why people can't wear a mask, especially foreigners. If you're here, wear a damn mask. We want to get the island open. I want to get my kids back in school. There's just so much, and wearing a mask, is that a big thing to ask? No. If you don't believe in COVID-19, go back to your country, because we need to get things together so we can open up. Are we going to open in July? It's looking less and less like the answer is no. Are we going to open in August? Maybe. Right now, with the cases like this, in my opinion, it's crazy to open up at this point, because, well, we just can't control people. The president has said this, the governor has said this, the police say this. People are tired. They've stopped wearing masks, some people. Our foreigners are not wearing masks, some of them. So we need more discipline. We need to finish up the vaccines. We need to remember to social distance. There are just all these health protocols. Do we need to open up economically? Definitely yes. But if we open up for international tourism and the numbers spike, what are we going to do? Are we going to close down? If we've got foreigners here, are we going to put them in a hospital? Are they going to take the place of Indonesians that may have to go to the hospital? How are you going to balance that? There are just so many different factors involved if we open up for international tourism right now before we have the virus under control, before we get back down to lower numbers. So I'm saying that as a person who has been affected by this, my children have been affected economically, job-wise, emotionally. When my oldest daughter was a nurse in Jakarta, I was worried about her every day. So I am directly affected by this. So when I say I don't think it's a good idea to open up right now, I'm saying that as a person who would like to see us opened up so that my son-in-laws and my son and my daughters can get back to work and carry on their life. But it just does not seem to be a good idea to open up right now until we get this under control. With the cases going up every day, and we don't know what we have here. Do we have the Delta variant? Are we just going to get a huge surge? What's going to happen in the next few weeks? Is the micro lockdown, are the micro lockdowns around the island, are they working? Are they not working? There's a lot of questions here, and so I'm looking at August, maybe September, if we're lucky and we can get this under control. Is that depressing? Yeah, it is. It's another depressing week, I'm afraid, but that's just the way the situation is. You take a look at some countries. There's an interesting report on Singapore that I didn't have a chance to go into today, and I'm going to try to put it on next week. So I hope you're well wherever you are. I see that Sydney is going through a lockdown again. because I don't know. I didn't read the details. There's a spread there. You're not here. Stay safe. If you are here, please follow the protocols. Wear a mask. Social distance. Wash your hands. Don't unnecessarily gather in huge crowds. And if you are stopped by the police or Indonesian authorities, behave yourself, pay your fine, whatever. Don't give them gruff. And if you want to come, well, as I've said before, I wouldn't bank on July. I wouldn't even bank on August at this point, but who knows? Maybe. We'll see what happens. Okay, that's it for today. And thanks for viewing. I was hoping for better news. Maybe next week. Stay safe. Be kind to someone today. Thanks for viewing. See you next time.